Okay, welcome to today's Coffee and Conversation. I'm Jackie Carrera. I'm the president and CEO of the Santa Barbara Foundation. And for those of you who are new to Santa Barbara Foundation or just new to this series, we hold these events every few months for our donors and our fund holders with the hope that it gives them an opportunity to be more engaged in philanthropy as we cover a whole range of issues that affect our community. We cover areas of community need, work that's being done by our amazing local partners, our nonprofits and government partners, and sometimes businesses and strategies in philanthropic giving. One quick housekeeping note before we get started. We ask that you remain on mute for the entirety of the event. We'll have time to answer questions at the end, so please use your chat function, and we'll try to get to everyone's questions as before the time is up. We'll also note that this event is being recorded, and we do that because there are a lot of people who request the recording after the fact. So, in fact, today is an example of when most of our attendees will be watching after the fact, our audience. We will switch to speaker view as everyone is speaking so that we can more easily see the panelists. But please note that when your camera is turned on, the screen format can be changed and you will be seen by others. Just FYI for that. And then we look forward to discussing some of the really important issues that are going on in our community today. We know at Santa Barbara Foundation years ago, we had decided to focus on a certain set of topics and issues that are of really great concern to our community. As a community foundation, we cover all kinds of issues from arts and music and theater and dance to behavioral health, mental health issues for our kids to the environment. I mean, we run the gamut of all of the issues, but we do focus especially on a few for a variety of reasons, but mostly because they come up as affecting our most vulnerable and have a broad impact on our community. And those range from behavioral health and healthcare to housing affordability to workforce development, and we've been really focused on digital equity as a component to that, and certain sectors within the workforce, like our promotores and our community health workers, and of course our childcare workforce as well, as we're going to talk about today. And then we also focus on food security. The biggest thing I think that we do that sort of underlies all of that is focus on the strength of our nonprofit sector. And we do that through our collaboration for social impact. And many times these coffee and conversations are held to cover one of those, or it could be something outside of those issue areas, or it could be about the nonprofit sector at large. But today we are talking about child care, and we're talking about access, we're talking about affordability, and the way that this affects the entire system and that its functionality affects our working families in Santa Barbara County. And it's our belief at Santa Barbara Foundation that every child should have access to quality and affordable care. We know that it's reliable care actually allows people to go to work and supports local businesses, and it also nurtures children during their most critical years. And yet we know that we have some issues with our child care system, including rising costs that create problems for the business model. We have long waiting lists. We have too few providers for a variety of reasons we're going to talk about today. And this is especially true for our infants and toddlers. So this isn't just a family issue. We know it's a workforce issue. It's an economic development issue. It's a community stability issue. And today we're going to talk about what we can do to what's being done, actually great work that's being done, and then what we can do together to continue to make improvements to that system. Our panelists, I'm really pleased to say, are some of the most experienced in childcare in our county and have been working on this issue for a long time and who are in it actively right now, still to this day. So I have great gratitude for the work that you all do. And I'd like to introduce Teresa Alvarez. She's the executive director of Children's Carpinteria Project, where she leads efforts to ensure all children enter kindergarten ready to thrive. She's got 20 years of of experience in youth development and family services. She's an amazing community leader, and we're so grateful that you're here today, Teresa. And we have James Kiriakou, who is a Goleta City Council member and a strong advocate for local childcare. I think if you asked anybody who as far as elected officials are concerned, the greatest advocate for childcare is, and they would absolutely say Council Member Kiriakou. Under his leadership, Goleta became the first city in the county to invest Measure B funds directly into childcare access and provider support. And so happy you're here today, Councilman. Thank you. And Eileen Monahan, the legend, she in childcare. She is a longtime early care and education specialist consultant who led the development recently of our Santa Barbara County Child Care Facilities Master Plan. She's done so much work in this area. I'll let her talk about it. But we are so happy to partner with Eileen on most recently our ARPA, which is a federal program that funded some work around childcare in Santa Barbara County. That allowed us and some other partners, which you'll hear about, get so many things done. We're so proud to work with you, Eileen, and we're going to hear about some of those strategies and where you think we should be going with childcare, given all that knowledge. Hope I didn't set that bar too high, but I will say there's no bar that you cannot reach when it comes to childcare, especially. Beatrice Garcia is our Director of Strategic Initiatives and Partnerships right here at the Santa Barbara Foundation. Beatrice leads our efforts to advance a few really important initiatives. One is childcare, of course, housing, workforce development, and then health equity across Santa Barbara County. And we've asked, as we often do, ask our staff, Beatrice today, to kick us off with a presentation where she's going to cover a little bit of sort of big picture, set the context. Why does this matter anyway? Where are we now? And what are the challenges and what's possible, kind of in summary. And then we're going to tease all that out with our panelists. So I'll turn it over to you, Beatrice. Thank you.
Okay. Third time's a charm. Good morning, everyone. I'm Beatriz Garcia. I am the Director of Strategic Initiatives and Partnerships here at the Santa Barbara Foundation, and I have the great honor of getting to work directly with our panelists and with our team that you see with us today. I'm really excited to be here and to be able to share some of this work that I think is really primed to create some large change if we really set forward on the vision that's laid out by our panelists today, but also following up on the work that we've done with the ARPA grant, as Jackie mentioned, and also the path that the master plan shares with us. So I'm really excited to be able to share that work with you. And I'm going to just share my screen. If you can give me a thumbs up if you can see my screen. Building our future. Great, thank you. So that's what we'll talk about today, is really building our future, expanding childcare access here in our county. We've been doing work as the foundation for many years on childcare in different strategies, and we'll talk a little bit more about that a little bit later in this presentation. But really, why does childcare matter in Santa Barbara? And we have experts here in the room, but also for those of you watching this, is why it matters to us. Really, we see childcare as a foundation for success. It's not just a family issue, as Jackie shared. It's really an economic infrastructure support for families. It allows for key economic stability for parents to remain in the workforce. And right now, the reality is that for many families, working families, childcare is just out of reach. It's not affordable and it's not accessible for some folks where there is no real access to care for their children, especially infants and toddlers. And really, we see that this matters because there are systemic solutions that working together we can implement that would change access and affordability for childcare. And there's already some models, and we'll look into that a little bit later in the presentation, but there's already models that we can learn from. There's models that have been built here locally from our trusted partners like children's resource and referral. There's the work that that Eileen has done for so many years, but now the master plan that will be published soon. And then there's the guide, the pathway that's already been created by the city of Goleta and Councilmember Kiriako's leadership that we can learn from and begin to expand on. So just really quick, some context, the cost of making ends meet here in Santa Barbara County, we're all very familiar with this reality. There's been several articles. The grand jury just came out also with their report. And really, as we look here, and this is information taken from the master plan, this you'll get to read more in depth about this particular graphic, but really looking at this, our families are paying 28% of their income and 22% of their income towards really basic needs, housing and childcare, that critical community infrastructure. And right now it's only getting worse. And so we find that for two parents living in Santa Barbara County with two children, they would need to earn up to $162,000 in change in order to afford childcare. And in some cases, childcare is costing more than housing. Like I said, taking up 28% of families' monthly budget. And that actually puts a lot of pressure on families to be able to figure out how to cover care. Do I leave the workforce so that I can take care of my children? Do I continue? It puts people in an impossible situation to decide. Now, as I mentioned, we have a long history of providing grants on for childcare. So I want to share here just the reality that we have experienced and seen the trend here at the foundation with our William and Lottie Daniel grant, which funds childcare scholarships for families. You'll see that our requests far exceed what we're able to award. So you'll see that there's a difference of hundreds of thousands of dollars or $100,000, $120,000 over the last 3 years. And we see that need continue to grow. We'd love to give more because the need is so great, and we expect that that will only continue. And then our childcare grant for workforce development, also we're seeing the need is so great because this is one of our key priority areas, is to strengthen the workforce. There is also just an extreme need from our partners who are providing this kind of care for their workforce to have quality care and what we're able to award. So the need far outpaces what we're able to give. Where are we now? We have made some progress, and I think there's more progress to be made. That's why these two little arrows are empty, because we're going to fill them in the next time we meet at Coffee and Conversation to give you an update. But really, we've made lots of progress with our ARPA support. We've, during the 3-year ARPA implementation, 1,599 new infant and toddler spaces were created or were expanded in different care settings and family childcare homes, as well as centers. That is an amazing number. It was, our partner, CR&R, has done an amazing job at building their model that supports family childcare centers and nonprofit centers to really ramp up, expand, and grow, or establish new businesses. There's also work done around stabilizing and after the pandemic reopening services. There's business licensing support, technical assistance. Out of the ARPA grant, there's stronger infrastructure. Now there's planning documents that can allow us, that will guide us forward. And there's also, the master plan, that is what will, like I mentioned, will guide us forward. But there's also already some stuff happening, some things that have that we can learn from, as I mentioned. City of Goleta, the sales tax measure that supports childcare for local families. We're about to award grants 2 childcare providers who've applied for the City of Goleta grant. We're in the process right now of reviewing. We also received an Uplift Catalyst grant for the Central Coast Childcare Expansion Project, which is actually the next step after ARPA. So that same model that was created by CRNR and put into use is now going to expand the number of spaces in Santa Barbara County, but also grow knowledge with our partners in 3 other counties in the Central Coast to have them understand the model and then provide grants for them to implement the model and hopefully scale it into the future. And we can grow childcare across the Central Coast region. And we're also part of the Central Coast Childcare Coalition led by First Five in San Luis Obispo. And we're at the table with representatives, allies, supporters of childcare across the 6 counties. So there's a lot of movement forward and momentum. Now there's still some gaps and there's still needs. We still need more care for infants and toddlers. The demand is really outpaces the supply. And because there's turnover, because kids age out of the infant toddler spaces, this is a number that's constantly in flux. So we need to continue to grow those spaces. We need to continue to strengthen the workforce, grow and sustain them, keep them strong, because when you have a strong workforce, you have quality care for children. We have the infrastructure challenge. How do we streamline processes? And Eileen will talk more about that during the questions and answers. There's the advocacy and parent engagement. There is a need for parents who use this service and the workforce to come together to use their voice to really push for the opportunity to really build out this infrastructure, this critical infrastructure. And then there's ongoing investment. There's a need for us to resource this change. And we learned from ARPA, there's already a model of bringing in different stakeholders and implementing a model and then learning from it, evaluating it, and then sharing, which is a great learning environment. Now, what's possible? We see that there's already counties in California that are finding solutions to the same problem that they're facing. In Sonoma County, which is a county very similar to us, they approved just last year, this is still barely rolling out, but they approved a measure I, investing in children in healthcare. This will generate $30 million that will be invested into children and children's health, and childcare. We see the same in San Francisco, a little bit different model where they passed Prop C and they're leveraging a commercial tax to be able to cover the cost of childcare. Now, San Francisco is a big city, big county in terms of population, but this is an innovative way that they've been able to respond to the need there. And what's possible for us in Santa Barbara? Lots. We've already seen with that progress, so much change and momentum. In front of us, we see really building a stronger childcare system to respond to needs. We foresee qualified and diverse early childhood workforce that's large and strong and can stay in Santa Barbara County where they work with higher wages, quality work, professional development opportunities. Then expand childcare access across all regions. We have some areas in our county that actually folks do not have access to any care. How can we respond to make sure that every child in every corner of our county has access to care? Then also, we need to establish a foundation for long-term change. There's already efforts in the region of coalitions, of collaboratives coming together. And now we have a guide with the facilities master plan. Now, how do we put it into action, put some feet on it, get some teeth in there, and really be able to do some long-term systems change? And it's not going to change overnight. It'll take us some time. And then also we can demonstrate and become a model that then other counties will be doing presentations that lay out the what's possible, and it says Santa Barbara County, right? So we can also create a model here. We've already seen the beginnings with the work that CRNR and CCPC have done, and now with the master plan that Eileen has so worked on so hard. And so, oh, sorry. Now, where did I go? Sorry about that. So there's a lots of opportunities, and our panelists will share a little bit more about that. And just a little bit about our childcare initiative. It is in our strategic initiatives. It's one of our focus areas. The tools that we use are convening diverse stakeholders, research, best practices in childcare, and creating external connections, really building out our network and bringing in expertise, aside from the expertise that you have here, to really begin to explore and deepen our understanding of solutions that have been implemented and then action them. And then also our grant making, which we will continue. And finally, advocacy and influence. Because of the relationships and our long history in the region, we definitely see the role of the foundation is playing some of that, influencing decision makers, providing support for research, really providing some guidance, creating the space, and then for us together to move forward. So that is where we're at with childcare. Sorry, that was so fast, but I am very excited about the possibilities that this lays out, and I'm looking forward to hearing from our panelists. Thank you so much.
Thank you, Beatrice. And you've really covered a lot with that presentation. So I'll reserve my comments and jump right into speaking with the panelists and just hearing about how all this translates to the ground, to Santa Barbara County. And Teresa, I'd like to start with you. If you can talk a little bit about your work and Carpinteria Children's Project and the amazing things you're doing there with families in CARP.
Yeah, thank you. Thank you so much for having me. And this is such a timely conversation. The Carpinteria Children's Project focuses on getting kids ready for school, but we know that we can't do that if their parents don't have the support that they need. So we provide early childhood education for 76 children. That's what we had enrolled last year. We have capacity for 92. And we follow best practices. So we definitely don't want to pack the rooms. But we are unique in that we have a family resource center embedded within our model. So our family resource center is across the hall from a lot of the classrooms, and families can refer over to the family resource center. The teachers can do the same, and they can provide the support that the family might need. So mental health support, direct services like food, and right now a lot of guidance around what's happening with immigration. We provide scholarships for kids, and the Santa Barbara Foundation, Lottie Daniel, has been really supportive in that we have about 67% of our kids are on some sort of financial aid. So that is either a scholarship that they receive or alternative payment, which is a voucher through the state for the parent to be able to afford childcare. And we're a small community of 13,000, but it's a very united community, and we are happy that we are able to provide these services for our town.
Teresa, before we move on, you have the capacity for 92, you have 76. What's the reason, I guess, for why it's not at 92? Is it because you're holding back just to create an environment that has space, or is it something else?
So our licensing, when licensing comes in and they let you know how many kids you can have in a classroom, we can have 24 in each of our classroom. But because some of our classrooms serve 18-month-olds, the ratios don't allow for us to have higher numbers. So in our 18-month-old classroom, we have 2 teachers and we have 8 children. So in those cases, we absolutely would not be able to put 24 kids. So the ratio is really quite, it's for the safety of the kids, but definitely can be an area that, doesn't allow us to serve as many kids as we would like.
I think people underestimate the complexity of running a child care center. And that is something that I just wanted to point out because it's a balancing act and probably more so than a lot of businesses. Thank you for sharing that. I had one more before we move on. A lot of people who are listening won't know what family resource centers are. They might think that that's something that you're providing, but I just want to underscore that that's a partnership. And can you just reflect on who provides the Family Resource Center and kind of a little bit about that?
Yeah, it is our staff. So for CARP
Oh,
Children's Project, it is completely a
you
part
all.
of our model. So where in some places it might be separate from the school or the other organizations, ours is embedded within the CARP Children's Projects. So the CARP Children's Project is early education, is Family Resource Center support. So it is our staff and they are family liaisons and work really closely. They're a part of the team. Yeah, so it's
That's
fully
great.
embedded.
Yeah, okay. I guess I did know that and I'd forgotten it for a minute, but that's really important to know that that model exists in different forms in various communities from Cuyama, Santa Maria, all the way to CARP. Thank you so much,
Yeah.
James. Champion, Childcare Champion, CCC, Triple C. Can you just tell us a little bit about how you've driven this issue through your work in Goleta as an elected official?
Well, thank you. And thank you, Jackie and Beatrice and everyone at the foundation for helping to bring us together today and to put together this powerhouse panel that I'm honored to be a part of. So I came onto the city council in Goleta in late 2018 with the goal of centering our children and youth at the heart of our decision making as a city. And so I've really pushed to address the childcare crisis, the crisis that's really been hiding in plain sight for decades, not just for years, but it's certainly become more visible in the aftermath of COVID-19. And so, what we've really been trying to do in Goleta is to remove barriers to childcare providers and to try and get more money in the system to empower parents, to empower families, to empower teachers and providers to help get more money into the system because there just really is not enough funding right now in the system to ensure that people have access to affordable and high quality childcare. And I saw this as a challenge really prior to serving on council. And so from Goleta to Guadalupe, from Cuyama to Carpinteria, there really is a need to take a regional approach. And so what I'm really trying to do with my colleagues in Goleta is to really try and provide an example of what's possible here locally, and then try and bring more folks to the party, so to speak, and trying to achieve more results. But we have been doing things such as pass a sales tax increase where we dedicate money year over year. In our last 2 year budget, we allocated $300,000 over 2 years. In our next 2 year budget, we'll be allocating $500,000 over 2 years. And so removing barriers to zoning, partnering with the city of Santa Barbara on a child care study that then kind of helped initiate some other actions locally and kick off some other actions locally, are some examples of things that we're doing in Goleta.
That's fantastic. Well, number one, I think just listening to you, I was thinking everything you're saying can be applied to the housing crisis too. So maybe after we solve this, we can just, move on to that one. Thanks for setting the model and the path forward. I do want to just comment that what you're talking about in Goleta is so important because you are really creating a model for how a jurisdiction can insert itself and play a critical role in solving a really important issue and through its own lens. And we did this with you during COVID, and I just was observing the fact that Jason Stillwell just joined the call, and he was the former city manager of Santa Maria. And after we struck up that partnership with Goleta, Santa Barbara Foundation and Goleta, to distribute some funds through COVID to get them as fast as possible to people that needed them. We took that model and went to Santa Maria and talked to Jason about it. And Jason picked it up right away, and we did it there. And then we went to the county, and then went to Santa Barbara, and it just sort of took off from there. So there really is something to that transferability of best practices and models. So thank you for sharing that. Eileen, the legend, please talk about I can't even name all the things, but if you can just briefly talk about your work and what you see as possible for our region's childcare sector.
Sure. And thank you so much for inviting me to be a part of this panel. It's really exciting to be with some of my favorite people on this panel. As a childcare consultant, I work with a lot of different organizations on most aspects of childcare, but I focus mostly on community systems and facilities. And really at the heart of it, I operate from this core belief that we need to make sure that the childcare operators who are doing this work have what they need to run successful businesses that then provide the services that we are all counting on. We're literally counting how many spaces they are serving, that they have available. It's a really tough job to run a childcare program. And on top of that, we need operators to expand and fill the gaps for families. And the childcare facilities development process is extremely complex. But I am feeling very hopeful. I feel like this is a pivotal moment. We have the will, we have organizations, we have leaders that are in this and interested and have the energy to move forward. And I think we then have this collective power to make things happen. And with this childcare facilities master plan that covers not even everything about about facilities, it's pretty in depth, but there's still so much more that people need to know, and people like Teresa need to deal with this all the time with her program. But with the master plan, I think we can seize this moment and address facilities head on. I feel like if we can make some distinct changes and some long lasting improvements, it's going to last us for a very long time and make real substantive changes to the childcare system that's going to affect facilities, but also the care that children receive and the burden on the operators and the availability to families. So I think this is the moment.
Eileen, I am so happy to hear you say that. I was going to say at the beginning that I've been doing this for 7 years and involved in this conversation about the childcare system. And I kept thinking, why is it so hard? The county's, in terms of size, it's not that big. Why can't we solve this? And then over that time, realized, okay, it's way more complex than meets the eye. And I was going to say at the beginning that I'm feeling hopeful, and this is a moment in time that we haven't really experienced before, and we're so lucky. But then I thought, well, maybe Eileen wouldn't agree with that. So let's see what she says. So I'm so happy that you said that. So thank you. I do want to pick up on the fact that you talked a little bit about how hard it is for providers, and you talk a lot to policymakers and providers and just everybody involved in this. About the barriers that they face. So can you just reflect for a minute on what you've heard about those barriers and what is making it so hard for providers to meet the need?
There are a number of different factors that are involved in having a childcare space available. And if you think of it from the macro level, it would be awesome, just like tire shops, for example. There's a variety of them. You can go to the one that you like and it feels good to you. And, hopefully they're all successful businesses. But for childcare, it's so specific. Childcare providers, like Teresa's explaining, you can't have a lot of surplus inventory and still make ends meet. And so, these levers that childcare providers have to move and shift to make the organization operate in the black are really each one itself. Workforce is one, and the facility is one, and tuition is another. All of those different things, how much you pay your staff, all of those things are the levers that Teresa and others have to very carefully move to make just the right situation for their organization to thrive. And so, in addition to just running the program that they have, we are asking, can you change this? Can you add new standards? Can you expand all of those things? It's a lot, and they need support and help and systems that will move them through it, and not so that they don't have to push through and learn how to be an architect and learn how to fill out their permit at the local planning department, and all of those different pieces make the job so complicated. And I just think there's support that's needed. I think each individual program needs different kinds of support, and having that specialized kind of assistance would really make a difference for all of the operators in our county, and allow us to have the capacity that we need.
So well, just summarized. Thank you. And so actually, Teresa, since we were talking about, since Eileen referenced your program, what do you, of all those levers and challenges that you're facing on a regular basis, what would you kind of put at the top of that list as the biggest vulnerabilities or the most urgent challenges?
I think, the cost of tuition. So someone running the program, we do get about 25% of our revenue from parents who can pay the full cost of childcare, and we're still very affordable. And it's hard to have those conversations with your board when you're saying, yes, we could raise the tuition, but then that means that the parent that afforded childcare last year might not be able to this year, because it probably means their rent also went up. So it's those kinds of conversations, what Eileen was talking about, all of the different guidelines and regulations and different departments not speaking to each other, and us getting sort of caught in the middle of it all, having to implement or not being able to implement, and not being able to make those changes fast enough. So all of those things get really tricky for us in terms of hiring staff, and even for our families, the cost of living is such a barrier. In trying to hire people, there were people who are applying from Ventura and just said, I can't take the job for that amount of pay, because then finding somewhere to stay in Carpinteria for the amount that rent is there with this amount of pay is just not going to work out. And the commute, just doesn't work for me. So, and even though we try to look at our pay and we look at our benefits and we try to keep that top of mind for retention purposes, it's still very difficult for people to make that choice. So that is a huge barrier. And some of our families are leaving and they're buying in Santa Paula. Two of our families, close families, that we have here in Carpinteria, have left to Santa Paula because they couldn't find anything in Carpinteria that they could afford, or Santa Barbara. And yet they want to keep their kids here to keep that sense of community and friends. And so they're making the commute, and it's just a really unfortunate circumstance.
Okay, thank you so much. I want to turning to James for a second. You've talked about helping in Goleta. One of the ways you're helping is through streamlining the permitting and some of the zoning and things like that. Can you just expand on that, since Teresa talked about that as one of the biggest barriers especially when there are unclear expectations from the governing agencies?
Sure. So I think, I guess I'll kind of take a step back. Our city, we recently did an economic development strategic plan just in the last few years. And we saw, you pointed out, Jackie, housing is also being a similar challenge. The city completely agreed with you. In fact, we made one of the major initiatives or planks of our strategic plan was addressing the twin crises of childcare and housing, affordability and accessibility. And so we're trying to solve them together. And one of the ways that we're doing that is we're trying to incentivize new development, whether it's new housing development or new commercial development, to include childcare as an accessory use. There's all the different reasons in the world why you would want to make something like that happen, but cities were never traditionally planned that way. They were really planned in a pre-1960s, 1970s mindset of what a family is and what young children are supposed to be doing with their time and what parents are supposed to be doing with their time. And we don't need to go too much further down that road. But in Goleta, what we're really trying to do is just make it easier for a new medical office building that's coming in next door to Gersh Park. That's going to have a child care center as part of that development because we prioritized that. It was originally going to be a gas station, and now it's going to be medical offices with a child care center that opens right up to Gersh Park. The future housing development on South Fairview that is owned by the Yardy family, we are anticipating a significant apartment development happening there that will have a child care center on site. So those types of kind of brick and mortar initiatives are really needed. And it's been great to see our partners in the county really trying to prioritize that through some of their development approaches and also the funding we've put in for ARPA. So it's been great to see our county partners doing things too. I guess what I'll close with is, if we want Goleta to be a great place to live, work, and play, you have to do something to address childcare. And so it can't just be, resolutions and statements and reports. I mean, there's got to be, tangible actions. And so whether it's putting our money where our mouths are or changing our zoning, incentivizing different types of development, that has to be part of the solution.
Well, thank you for your leadership in that area. And it would be great to see how those various models play out. And also for Eileen to keep a keen eye on where those barriers are after they roll out and try to, make sure that there aren't any, permitting or other land use or other challenges that come down the pike, facilities. But before we get to, I don't want to go too deep into the facilities piece, but I do want to go back to the childcare workforce that we talked about. Teresa, you really laid out so clearly the challenges that you're having with staff, the cost of living, finding a place to live, managing what they're getting paid versus what they're paying to survive. And as a result of that, what's happening. Eileen, I'm going to start with you on this one. What are you hearing about from other childcare providers when it comes to workforce, that it is similar or even different from what Teresa has said, and some things that we really need to be paying attention to?
I hope that Teresa will agree with this, but it seems like the horrible extreme staffing challenges related to COVID have subsided somewhat. So it's now we're sort of back to it being difficult to find staff, not impossible. And I think we don't have classrooms that are closed because there are not enough staff, those kinds of things, which is good news. We'll start with the hopeful part. Um, I think part of what I hear is the shifting, the shift that's happening with childcare programs who typically served up to age 5, because 4-year-olds are going to transitional kindergarten quite a bit. Parents are choosing that. The balance that happens with all of those ages under one roof isn't really happening. So it's a smaller group of ages that providers are serving. And the fact is that not everyone wants to do every job. And even though it's still caring for children, some people, if you've been teaching preschoolers for 15 years and now you're being asked to serve infants, first you have to get special training for that. It's required. You have to want to do that and have that affinity. It's different caring for infants than it is for preschoolers. And we want the teachers to love what they're doing. So it's not just a job and we're going to put you over here. It's a very different sort of calling sometimes. Some are more flexible, but that's what I hear a lot is people just not wanting, they prefer serving preschoolers, and so there aren't as many preschoolers. So it's a big deal, I think. This shift that we talk about is a really big deal for the teachers themselves. It's a big organizational issue for the programs, or not always an issue, but it's something that they are working through. The community is thinking about it, but for the teachers themselves, it's a very personal thing.
Yeah, that's really interesting. And I think the business model probably changed as well when the number of the older kids left and you had a different student teacher ratio. And that's probably one of the challenges there as well. Teresa, did you want to add anything to the workforce challenges?
I would agree with Eileen. I think we are getting more people applying for the positions, and then there are other barriers that come up. But I think another challenge is having substitutes. I think after the pandemic, we saw that people, could apply to different restaurants and different stores for about the same amount of pay, if not more, sometimes in the early childhood field was providing. And we didn't lose a lot of people because of that reason, but I think there aren't as many people looking for part-time work. They're just needing also full-time work, and this has been expensive, but we have several part-time teachers, and that's how we've been able to make it work when I do have more than one or two teachers out, which happens, especially during flu season and everyone is sick and everyone's out. So that has continued to be a challenge. And I know some of my colleagues and I have talked about how we could maybe share a person, and we're trying to find out what the logistics are around that, with licensing and fingerprinting and all of that. So that continues to be a challenge. Just what do you do when you have a lot of staff that are out? We've had to merge classrooms. Luckily, some of our Family Resource Center staff have units, and we can put them into the classroom, and but then they can't do their work. And so it's just it's a balancing act all the time, it feels like.
I'm going to get you a unicycle just for fun.
Right.
James, as far as government is concerned, did you have any reflections on your role in helping to balance the workforce, or is this, or not so much?
No, I mean that's a big part of the economic development strategic plan. Is you have to basically be planning for the workforce of the future. I mean, one of the cool things about childcare is it's one of the few endeavors where if you're putting resources into dealing with it, you help four different workforces. You help the employee who's a parent, you help the coworkers of that employee who now have a more reliable, well-adjusted, happier coworker, and not having to worry about covering and sudden absences out of the office, that kind of thing. But then also the child, and then the providers themselves, right? So there's a lot of different benefits out there when you do this work. And the city, the GLETA grant program, I think is the GLETA Childcare grant program, I think is a good example of putting money out there that can go to specific providers that can help their employees, help pay better, help open up spots, help ensure that there is work to do that day and they don't have to go home because too many children came out sick or whatever the thing is. So there's a lot of different ways that local government needs to be part of the solution when it comes to supporting the workforce. If we can create a local preference program that doesn't just look to support local employees, but you could give special dispensation to folks that work in that sector. That could be, when you're talking about subsidized housing programs and affordable, capitally affordable housing, that's another way to try and get at it. But really, at the end of the day, we're going to need a much larger local initiative than something GLETA can do on its own, or Carpinteria, which I know has done things to support their childcare folks as well. We really kind of need to all be in this together to address, I would argue, the twin crises of childcare and housing. And I agree with you; they do go together.
Yeah. Thank you. And we're going to come back to some of the things that you said, but I just want to veer off to North County for a second. And just thinking about Guadalupe and Orchid and Cuyama and some of the areas that have had real challenges with licensed infant and toddler programs. And I think I just want to talk to Eileen just for a second about this, because you have such a broad view of the county with all the work that you've done. But can you help us understand why some of those gaps exist, especially in rural areas in North County, from your perspective and what you've learned? Yeah. Oh, you're on mute.
You would think this is the first time.
I know. I'll do it.
I will start with the good news. One is that we do have, this often is hidden in the data, but family childcare operators can and do serve infants and toddlers. It's just that their license is for all ages of children, so we can't always see exactly how many. So there family childcare everywhere in our county, and so there is some available everywhere. And second, the Housing Authority for the County of Santa Barbara just opened its new Escalante Meadows Community Center, Housing and Child Care Center in Guadalupe, and infants and toddlers are the primary target for that. So it can happen, but that took a long time. Just always my cautionary tale about facilities. Is that it does take a long time, and we just have to remember that. So, but I think I think what we've talked about this just little bits and pieces today, but the math for infant toddler care is difficult. It's not easy to we don't see very many just infant and toddler childcare programs, and there's a reason. And Teresa explained it exactly, that there's just, you have a childcare center classroom that's set up for preschool. You cannot fit the same number of infants and toddlers in that classroom. And so you either need to build more classrooms or you need to serve fewer children. And so standalone infant and toddler programs are far and few between. I don't actually know how they do it. So, and the same is true in family childcare to a certain degree, where the more infants they have, the fewer, it's disproportionate. The number of older, I don't know how to say it, they can serve less and less older children. It's not a one-to-one.
Mm-hmm.
So it's set up properly in that we have more we have fewer children per teacher when the children are younger, but the result of that in a sort of structural way is that we don't have as much, we can't serve the full capacity of a program. And so it's just inherent in how we're doing things. What James talked about is co-locating childcare with housing is one of the stellar, strategies that we should be jumping on right now, because there's so much housing being developed, and that cost of building a center can be incorporated into the cost of the whole development. And so right away there's a savings, and the burden is not on the childcare operator then, and it's more possible to make that shift. And I just wanted to mention, I have one little statistics. We did a little sort of scenario that was not based on any particular program, but we took a program that served 93 children, 0 to 5, and looked at those classrooms, the number of children in each classroom, and then converted it to a program that served few or no 4 and 5-year-olds. And it went from serving 93 children to serving only 66 children. So we've lost 30 children in that one center because we're focusing on infant toddlers, which is great for the infants and toddlers.
Mm-hmm.
And the parents, don't know the difference really, but for the operator, again, the burden is on the operator to make the magic happen somehow.
Mm-hmm. Oh, that's a really illustrative. Thank you for sharing that.
Mm-hmm.
I know we're running out of time, and I have the one big question that I have for you all is, what more can we do as a philanthropic community to support you? But I just want to give you a chance to raise any other thoughts or issues that you have about barriers that you're facing that we haven't covered. Teresa.
I was just going to add to something that Eileen started talking about. So with the transitional kindergarten expansion, and I think this will happen more maybe for the reasons that you were talking about. Some teachers just don't want to work with infants and are comfortable in that preschool space. So we did lose one teacher who went to the school district and to work in transitional kindergarten. And I wonder if that will happen more and more. And we, when the school district was going younger, the education system was going younger, we went younger too. And that's why we have 2 18-month-old classrooms this year. but it was a challenge to convince some of the teachers and say, well, this is what we have available. Luckily for the Carpenter Children's Project, we had an infant program before. So a lot of our staff, a lot of them have been with us for many, many years, had those infant units. And so there were very few teachers that we were able to support in getting infant units through the workforce pathway, and that initiative to get those infant units, to teachers. But we know that that might change as people, start seeing that we're bringing in more and more younger ones, that they might want to make that jump, and for the pay as well, and the summers off. And so it's going to be hard to compete with that.
Yeah, you all are so flexible. I just had the great privilege of going to visit LEAP's new facility in Lompoc. And and I've seen, of course, their facilities in Isla Vista and in South County. And the flexibility, in addition to that constant balancing, is really extraordinary. And I'm just so grateful. I know we all are, to you, and especially Katie, as her little one crosses the screen as she's sitting with us today. We are all really grateful for what you're doing. So just thinking about Santa Barbara Foundation and our donors and our partners, funding partners, everyone wants to see our community thrive. If you just want to go around real quick and ask, what more can we do to support you right now, given the current situation, and also knowing that we have, as Beatrice so eloquently laid out, all of these great coalitions that are being built, and this work is planning to continue. We're planning to continue it with the support of Uplift grant from the state and all these other things. What else can we do for and with you to support you?
I'd love to jump in and take
Oh,
that.
good. Please, James, go.
So one of the great things about being in my position is people will come up to me and say things, and many times they're people in the philanthropic community. And one of the encouraging things that I hear is, someone will come up to me and like, more affordable housing, and I think that's great. What I think we need, where I think we need to get to, is in terms of bringing other elected folks along and other communities along with public dollars. I think to the extent that our philanthropic community could start having those kinds of conversations with me and other elected officials. What are you doing about childcare? What are you doing about childcare? I think that would be really helpful. At the end of the day, I feel like we have elected officials throughout this county at the city level and the county level who are open, receptive, want to do the right thing, want to be champions, and but they can't do it by themselves. And I think that the philanthropic community, which often intersects with us in different other different types of ways, to the extent that you can urge us, encourage us, say you'll be standing there with us, other private partnerships. I mean, the money that Galita's putting in, having the foundation behind it, that money goes farther, that money gets added to, right? And so you get that compounding effect, much like you get with other investments. So I think if we ever want to get to a place where we can have, I'll just throw out a hypothetical that for me is not so hypothetical, a county-wide initiative that would fund affordable housing and affordable childcare. If we ever want to get there, we have to start talking about the childcare piece of that. Because they're both examples of broken markets or nearly broken markets where it doesn't just work to just have more facility all by itself or more building all by itself. You have to solve it on the finance side, you have to solve it on the equity for worker side, and you have to solve it for the empowering parent side. If you can't address that three-legged stool, you'll never get there. So
yeah,
I would say philanthropy should be putting money in, but also putting words in our ears.
okay, done. And the co-location and sort of meshing of those two issues too, Eileen's underscored that. We have no time left, but I wanted to offer Eileen and Teresa to say, did you want to add anything to that before we go? You can
I'll
also
just
say thumbs up. Go ahead.
I second what James said. I just think if you can spur people to come together around the issues, I
Mhm.
think that is going to make a big difference. So we don't have a lot of separate initiatives going on. That if we're under one tent, I think we're going to accomplish more.
Love that. Thank you, Eileen and Teresa.
Yeah, I would agree. I think be a champion alongside us on all things that affect children. I think right now what we're seeing happening in our community is going to be impactful for years and years to come. And, we have parents that are not bringing their kids to school or not going to work, and that's going to affect everyone. So I think any way you can use your voice along with your philanthropic dollars, do so. This is absolutely the time.
Oh, thank you all. I have chills. I'm so grateful for you. I know we all are. And if anyone who is listening to this video presentation feels inspired and moved to get involved, either using your voice or your dollars, whatever it is, please contact us. Either reach out to Teresa to support CCP, Eileen, James, or any of our staff at the Santa Barbara Foundation. We are happy to make any and all connections. Thank you all for being here today, and have a wonderful rest of your day.